Hi, everybody. So I'm Megan Thompson with Megan Thompson Coaching, and I wanted to just get in here today because I was compelled by a call that I just finished with a parent of a highly sensitive kid to speak about a topic that's been on my mind and has been brought up in this group many times, as well as discussed in various posts here, as well as on the calls when I speak to parents. I want to discuss how and why behavioral treatments like applied behavioral analysis or ABA, PCIT, parent-child interaction therapy, and sticker charts and rewards charts, all of those sorts of behavior-focused treatments are ruining your kids' emotional intelligence. Now, guys, I don't use words lightly. I choose my words carefully, number one, because semantics are so important with HSPs, as some of you are, but also because my words come from my experience. And so I want to speak about that first. So my training is in play therapy at first. So I'm a play therapist at heart. I enjoy playing with children and learning and helping them learn about their emotions through play and connecting at the heart level first before we help children change their behavior. And so that is my foundational expertise, as well as my soul being as a mother, with friends. You know, humor is something that you guys don't always see from me because I'm speaking from a professional capacity a lot of the time. But it is very important to experience life playfully and to learn playfully. And so I really want to talk about why these behavioral treatments are not working for your kid and why you should avoid them like the plague, and avoid professionals who advise that you use them like the plague. And I'm very pointed here for very, very many reasons, and we'll get into that today. So first, what I want to do is talk about why parents get trapped in this perspective. This is something that a lot of parents will hear or feel or experience in your upbringing. Okay, a lot of us were probably raised with chore charts and sticker charts and gummies for the potty and little toy trinkets when we do something well, money with our report cards. And that's the old way. That is how children were raised when we didn't understand emotions. Hi, Jenny. Everybody say hi if you're here. Hashtag replay if you're catching it on the replay. Previously, before we started to really dive into the understanding and a more societal level, now therapists and mental health professionals and some parenting experts have been focusing on this for many years. So I'm not saying this is brand new stuff. This is stuff that's been researched and supported in the research for decades. But common knowledge, society's common knowledge, has parented typically, at least in our typical Western go culture, from the understanding that children need to perform at a certain level, and if they're not doing that, then they're behaving poorly. And so it's a behavior issue. And so what happens? We see a pocket of mental health treatment that train kids out of their ineffective behavior. And that's what ABA and PCIT do. And I really want to talk about this because on a passionate level, I view it as similar to shock training a dog. And I'm not, I'm just calling it tight here, guys. We're going to get really clear and probably get a little ranty today, and I'll try not to drop an F-bomb, but who knows? What I'm trying to address here for you guys is that you cannot use a treatment that's designed to train your child like a dog and expect your child to feel their feelings. So hi, Bliss, say hi. And when we understand that, it's very clear how you can seek support for your child if you're in the point where you're ready to make a change and you need to work with a professional to do that. So let's get back to what I was talking about. If you're just viewing your child's ineffective behavior, inappropriate behavior, hitting, kicking, spitting, throwing things, name calling, pushing siblings, starting fights, having a meltdown when it's time to get out the door, calling you names, saying I hate you, saying you don't love me anymore, or at the very worst, thinking about dying or wanting to die, or trying to kill themselves. If you just view it as a behavior that you need to stop, I need to get my kid to stop doing this thing, then you're missing the cause and you're just focusing on the symptom. This behavior is a symptom of your child's inability to manage their own emotions. And so what happens when we think about professionals and how they are trained is that we always end up in pockets of understanding. And some professionals, some schools of thought, some parenting schools of thought view children and people as, for lack of a better word, robotic. Like I give you this reward, you reach for it. I give you this reward, you reach for it. I give you this reward, you reach for it. We know in our heart of hearts that life is not about obtaining tangible things. But what ABA and PCIT and other behavioral type trainings or treatments teach is that you're not good enough until you reach the goal. And so you don't get the treat, you don't get the sticker, you don't get the reward, you don't get the hug, you don't get the attention, which is what PCIT focuses on, until you do what I say or do what I need to do. What's missing here is that your child's underlying problem in regulating their emotion, managing their big feelings, is the cause of that behavior. So if your kid, and I just spoke about this the other day, I can't even remember if it was yesterday. Yeah, it was probably yesterday. Sorry, guys, my days are blending. I just spoke about this yesterday in terms of how anger is a safety cage for shame. So go and watch that if you're missing some of that underlying feeling type stuff. We'll get into that in a little bit today, but I really have to talk about my professional observation, opinion, as well as the evidence that backs up the fact that these treatments are not effective for your children. And that's the primary focus of today's training. What we're doing here is understanding that if you're not recognizing that your child's emotions, sadness, disappointment, fear, frustration, worry, anxiety, overwhelm, discomfort, huge for highly sensitive kids, is leading to their behavior. Cause, effect, okay? And you're just focusing on fixing the behavior. What do I do? My kid won't brush his teeth. What do I do? My kid won't, is calling his sister names. What do I do? My kid is melting down on the way to go to school. We can come up with a wealth of lists, right? If you're just focusing on that, then you're training your kid like a dog. And now I have an animal assisted dog who comes, I do animal assisted therapy here, and I don't even train my dog with behavioral, responses. We focus on love, connection first, rapport in that relationship, because I understand that my dog has feelings, and hopefully, and a lot of you who are HSPs or you have HSCs, you notice animals have feelings. So if we understand at a core that animals have feelings and humans have feelings, then why are we treating our kids lower than a non-feeling being? I mean, that's an object, guys. So if that's what's going on, why are we even buying into the fact or thought that a sticker is going to motivate your kid for behavior, or that a treat is going to motivate your kid to change their behavior? Their core heart of hearts of feeling okay, being healthy, happy, joyful, excited, and motivated to live their life at the fullest potential. That's what we need to focus on. That's what drives behavior. If you feel like a piece of shit, then you're going to act like somebody who doesn't deserve all of what's going on in the world. And so if that's what's happening, guys, then we can't be focusing on training your kid out of meltdowns. You can't be focusing on training your kid out of hitting. You can't be focusing on training your kid out of brushing their teeth ineffectively or refusing to brush their teeth. And that's what these treatments do. So let's get into what these treatments are, understanding a little bit more about that, so that you can clearly understand the difference of what's out there for you locally if your child needs a local professional in your arsenal of support, as well as understanding where the some pockets of professionals lie in their perspective. And we have to also look at the medical community in that as well. Because again, I'm a licensed clinical professional counselor in 2 states and a registered play therapist supervisor, so I'm not a doctor. And it's also true that I work with a lot of pediatricians. So I have that experience in that respect, and nurses, psychiatric nurse practitioners, and we have we serve doctors in our in my coaching program as well as in my private practice. So lots of understanding of the medical community. So and my mom's a nurse, I guess I should add that too. So we have that. So let's understand here. What we're focusing on is understanding that applied behavioral analysis is training your kid from a behavioral standpoint, that their behavior is what needs to change, to get a reward if they do the behavior that you're looking for them from them. So what this looks like is, in general and in very broad terms, is a sticker chart, but more systematic at home, and maybe you focus on praise. Good job, you did that. Here's your reward. Let's ignore the ineffective behavior, completely shut down emotionally in any sort of connection with my kid if they are whining, complaining, having a meltdown, or anything of that nature. And that sort of treatment shuts your kid off to feeling emotionally connected to you. Because if you're working with a professional who says just ignore it, they'll either grow out of it or they'll stop because they're not getting attention from it. Then you're working with somebody who's treating your child like a robot. Their professional understanding of how the human brain and heart works is that we can systematically change our behavior in a robotic way. And that's just bullshit. I mean, let's just call it tight. That's bullshit, because we all know, and you can probably sense the energy from me coming through the screen at this point, we all know that we're driven by our emotions. We are driven by our emotional understanding of who we are as people. Children are no different. And in fact, they are more focused on their emotions, and they are our teachers in the world of what we're doing that's not effective, because when your kid's blowing up, it means they feel emotionally unsatisfied in their core being. And that's devastating to them on a daily level. So much so that they're having daily meltdowns. And so when we look at that understanding, and then you think about completely disregarding that and just saying, well, you'll get what you want when you behave, what does that say to your kid? It says that the only way you know how to communicate to me now is not worthy of my consideration. I won't even consider understanding you, let alone loving you or showing compassion or true care. Providing true care to your kid. I won't even consider you. Guys, that's the same as like treating your kid like a tissue box. I don't need you right now. It's in the corner of my desk. An object. Your kid is not an object. Your kid is not a dog. And most of us, hopefully, view animals as feeling beings, and so we don't even treat our animals like that. And so when we understand that the core component of these treatments is behavioral focused, and understanding that the other more popular treatment for kids who are not on the spectrum, because some kids who have an autism spectrum diagnosis will end up in ABA treatment. And there's other treatments out there for those of you whose kids are on the spectrum and also highly sensitive. So that's often necessary for kids whose kids are on the spectrum. Stephanie Seek, my son's teacher has been trying to get kindergartners to do first time obedience. Yeah, I mean, your emojis is basically how I want to like act towards the person, but obviously that's not nice. And I have more compassion and understanding the fact that she just doesn't get it. I say what you need me to, I'm asking you to do something. You better do it right away. If you don't do it right away, then you're not good enough. And you don't get to think deeply about this. You don't get to feel deeply about this. You don't get to struggle with transitions. You don't get to notice subtle things that make you contemplate how to actually follow my direction. You don't get to be yourself as a child if I'm asking you to do what I said to do on the first try. Kindergartners, guys. I mean, we see this with parents who are seeking support, with even younger than that, but kindergartners are just not capable on a developmental level of operating in that way without completely discounting their emotional existence. So there you have it. So Stephanie, I sit with your frustration. And so the next thing that we're talking about here is understanding other types of evidence-based treatment for helping children with behavioral issues, and a mental health treatment, which, as a member of the mental health field, I've been working in this field since I was in high school, with a high school internship at a residential treatment center for young kids. It's not healthy to consider behavior treatment a treatment. So I say the word mental health treatment and PCIT in the same sentence, tongue in cheek, just for logistical standpoints, quite frankly. But what we're getting at here is understanding that parent-child interaction therapy, which is the type of therapy where a therapist will sit in a playroom with the child and the parent, or teach the parent how to interact with the child with a bug in your ear, or with directives while observing the work, depending on how the setup is in the building. And so they consider it playtime, where the child is playing and the parent is playing with the child, but the type of play is used to manipulate the child rather than to join with the child's emotional experience. And so when that happens, the parent is taught to completely ignore the child when they express frustration in their currently ineffective way. Currently ineffective way, meaning throwing a toy, yelling, screaming, refusing to follow a direction. And so what that happens is the parent is then instructed to, and literally coached to, stay strong, to not engage with the child's ineffective behavior, otherwise known as misbehavior. And when that happens, you feel it. I mean, guys, if you're really tapped into your own emotions, or at least on some level picking up on this, you feel when you're ignoring your kid emotionally, and that shit hurts. I'm a parent of a 3-year-old. I know what it's like to help a child whom I birthed, who I care for on a daily basis, manage her big emotions. And when I am either stuck in a pattern or feeling compelled to ignore her behavior, there's a tug there that says, you're missing something. This is not right. And so what we're noticing here in those moments is that you as the parent are taught to sever the relationship. Cut it. I don't see you. I don't hear you. I don't notice you. I don't consider you until you get it together, until you perform to the way I want you to perform. And so that evidence-based treatment was found to be effective in helping parents who used to abuse their kids eliminate abuse. And so that's the primary use of that treatment, is to, in terms of the research and how it's studied, a lot of the studies are focused on, does it help improve the relationship when abuse is in the relationship? Now, guys, those of you who are in this group, I can't imagine that that's your current experience. Some of you may really struggle to not spank or use corporal punishment, and that's a problem that needs to be addressed. But there's a big difference, and still both very serious, between spanking your child because you have no skills in how to teach your child to manage and understand their emotions, and abusing your child because you have a problem managing your own anger and you don't consider your child as a human with feelings. And so, yeah, sure, if you're struggling with the cycle of abuse and in those deep angry moments as a parent, if a parent has that history of being an abusive parent, likely because of their own abuse and the cycle that's needing to be broken, then sure, PCIT is better than nothing. It's better than abusing your kid. But we're not there, guys. We're not there here in this group. This is not these are not the parents I'm looking for you to be. And if anybody who knows me, whether it be here or in personal relationships, for some of you who know me in that respect, when you meet and interact with me, you better be ready to be your highest self, because it's just what happens around me when I speak with people. I hold people accountable to the highest possible person you can be. And it happens all across my friendships and my relationships and all aspects of life, as well as professionally. And so if you're here, you're drawn to that. You're drawn to that. If you watch my videos, you're drawn to that piece, that there's something in you, and I know is my purpose in life. There's something in you that's drawn to be your best person that you can be on this earth. And so if that's the case, then you can't work with professionals who think that you're a robot, because if they think your kid's a robot, they think you're a robot. So, because it's just the way they view humans, and how you change behavior. And so it just doesn't work that way. That's not the way we are put on this earth, and it's not the way that humans experience life. It's inaccurate. And so when we think about the facts and the truth that children's feelings are to be loved, nurtured, cared for, and supported in improvement of expression, improve the expression of that emotion so that it no longer is destructive, then we can't disregard it and focus on the behavior. Those two things they're not meshing. So I have to summarize where I'm coming from here in this respect, in terms of those of you who are watching and catching this live, and what we addressed at the beginning is that if you're working with anybody, or you're following anybody, or you're focused on anybody who's teaching you, or you're helping your child follow directions from an adult who's teaching, that they just need to change their behavior, then you're missing the drive that sets them up for reaching the goals that you want them to reach. Now, we all know that intention is everything. And if you can have poor intention in completing a job and you won't do it well because your heart's not in it. And so that plays out throughout all aspects of life. You know it if you go to work. If your heart's not in it, you're not going to do the project well. You probably won't get the promotion. If your kid is expected to do their homework and their heart's not in it, they half-ass it, they'll probably get a B or a C or a lower than an A. Some highly intelligent HSCs will get the A, and then you have the problem of figuring out how to draw out that core heart experience, that love for themselves in order to want to do their best to reach their full potential. And that doesn't work if you're just focusing on the behavior. So if we understand that this is what drives human behavior, emotions drive human behavior, emotional assessment of what's going on, the emotional assessment of who I am as a person drives my behavior. When I feel awesome, I act awesomely. When I feel excited about my life and my life's opportunities, I grab the bull by the horns. And this is true for all children, not just non-HSCs. Highly sensitive kids can grab the bull by the horns, can thrive in challenge when they feel at their core center of their being complete. And you as their parent are the one that needs to dictate how they reach that goal. And if you need support in getting there, be sure to reach out, because I can help you do that. When we think about the clients that I help in my program, we focus on helping you understand the underlying reason why your child is struggling in this way, and then we break that down so that you build and rebuild that self-compassion and shift out of that dynamic. And so we think about what's working and what's not working in the mental health field. And I know I said I mentioned the medical field today. A lot of you will get, if you go to first to your kid's pediatrician, will be advised to seek advice from a behavioral therapist. That's like the typical language that we hear in all ways that people come to our practice, but in terms of as mental health professionals, pediatricians view medical treatment as medical treatment and mental health treatment as behavioral treatment. And there's a behavior problem, so treat the behavior. It's very similar to a lot of medical treatment. There's a sickness, fix it, versus really looking at the core. So, if you're lucky enough to have a holistic doctor or somebody who's understanding the whole picture of the person as a whole, then they understand that the child who keeps coming in sick to their office may have an emotional component that needs to be addressed, or may have a dietary concern that needs to be addressed, or whatever. But the majority of the medical community is still look at the behavior, look at what's coming at me, look at the spots on the skin, solve the spots on the skin problem, put an ointment on it, that sort of response. Or, look at the kid who's having a behavioral problem. Well, there's a great pill that you can just pop and start taking to get rid of that behavior. Well, wait a minute, what's actually causing it? Let's address that problem, because that's the core. The behavior is the symptom. And so if you treat the symptom, you'll keep seeing symptoms and you'll play whack-a-mole for the rest of your life as a parent, and for your kid's life as an adult, because they will never understand. And we know there's lots of adults, and maybe you don't know, but I know there's lots of adults out there in the world, and I just wrote about this, posted this today earlier, who don't understand that their emotions are what's driving their behavior. And so when you sabotage yourself in all aspects or different aspects of your life, it's because you're not clear on your own emotional experiences and how you view yourself as worthy of having all that you want in this world, on this earth. And so if that's happening, and you're seeing yourself here in a struggle, effectively parenting your child, and worried about how that's going to teach your child to value themselves, then I would encourage you to reach out and get on the phone with me and fix it, but in a core way rather than just fixing the behavior. So go ahead and go to meganthompsoncoaching.com/talk. We'll talk about what your struggles are, where you want to go, and whether or not I can help you do that. And if I can, I'll tell you how. And if I can't, I'll send you in the direction of what needs to happen first before we would be a good fit to work together, if that's something that would happen in the future. And so I want to encourage you to go ahead and take care of that. And I have an appointment, so I got to roll. #end rant. I will talk to you guys later. Have a good day.